Welcome to the Simplified Dentistry podcast. Join us as we discuss clinical, operational, and financial aspects of your practice, help you enjoy life, and dare to simplify dentistry.
Welcome back to the Simplified Dentistry podcast. I'm Dr. Mustafa Shah-Khan, along with my brother and co-host, Dr. Murtuza Shah-Khan. We'd like to welcome today's guest, Dr. Gregg Kinzer. Dr. Kinzer received his DDS degree from the University of Washington in 1995 and his MSD and certificate in prosthodontics in 1998. Dr. Kinzer is an internationally recognized speaker and current president of the American Academy of Aesthetic Dentistry. He is a full-time teaching faculty chair, and director of curriculum and campus education for Spear Education in Scottsdale, Arizona. We'd like to thank our sponsor, Comet USA. Comet equips the people behind every beautiful smile. They provide thoughtfully innovative and high-performance instruments you can trust to deliver care you're proud of and results your patients will never forget. Comet burrs are the only burrs that I use in my office. Learn more and shop online at cometusa.com. We want to welcome Dr. Gregg Kinzer with us today. Gregg, thank you for being with us. Look forward to this conversation and seeing how things are going with you.
My pleasure.
So what we like to ask people is kind of a little bit about their journey. Go over your journey into dentistry, what got you there, and kind of how you've kind of transitioned through education and all that sort of stuff.
Yeah, my journey into dentistry is an interesting one because I didn't have any aspirations to be in dentistry at all growing up. My parents, no family members, nobody was in dentistry. Although I grew up in a small town in Eastern Washington, and as any small town kid, I mowed lawns, and one of the lawns that I mowed growing up was just happened to be an orthodontist. And this guy was killing it, right? He had a beautiful home and beautiful yard, little stream going through it, had horses, like it was great. I said, "What's that guy do?" "Oh, he's an orthodontist." I said, "What is that?" I said, "I want to do that."
Yeah.
Right. So I kind of got into dentistry, and then our neighbor turned out, neighbor moved in. He just happened to be a dentist. So that was my inspiration. Was I had a neighbor that was a dentist, and I took care of a guy's lawn. But my goal was to actually be an orthodontist, right? So I went to dental school with that as my goal, and got sidetracked into pros because it was fun. I finished my requirements relatively soon, and so I got sent, bigger cases, and I had a prosthodontist as my go-to faculty, like he was assigned to my space, and so I was doing some bigger cases with him, and he just kept kind of putting it in my ear, like, "Hey, Gregg, have you thought about doing pros?" And I'm like, "No, dude, I'm doing ortho."
That's right.
Right?
Yeah.
But every time I'd have him in clinic, he would say the same things. And finally, when you get into your third year and you start looking at the application process, there was a boatload of people in my year that were going to, specialize, and a lot of them were going into ortho. But nobody was going into pros, right? And I started looking at it more, and I said, it's really enjoyable. I like that aspect of it. I like the immediate gratification of changing something aesthetically or functionally. And so I got into pros, and even in pros, so I went to pros at Washington as well. I looked at finishing pros and going into ortho. Like it still had it in the back of my mind that I wanted to do it. And I don't know if you guys know a name, Ward Smalley. Ward Smalley was a UW trained prosthodontist who practiced a while, that went back and did ortho, and then practiced as an orthodontist. And so he was one of our faculty. And I said to Ward, I'm thinking of going into to ortho when I'm done. And he said, "I would encourage you to practice a little bit, right? Don't just jump from program to program. Practice as a prosthodontist. If you go for a couple of years and you still have this bug in your ear about going into ortho, I'll support it. But you got to give me some time out there working." And I said, "All right." And then probably a few months later, I get a call at the school from Frank Spear that had asked if I might want to be going into practice with him when I finished. And then all my aspirations of ortho went away. So I was like, wow, this is like a dream come true. Because we used to sit around, you're in the pros program, you would be doing all your lab work. You'd be sitting in the pros lab, it'd be midnight, and you would just make up scenarios to help the time go by, and you'd ask questions. And one of the questions that we continually asked each other was like, if you had a magic wand and you could go into practice with anyone, where would you go? Because our two big influences at that time were Frank Spear and John Koist, because they would invite us to their courses.
Oh, wow.
And so it was like, that you're choosing Frank or John, right? It's like Elvis or the Beatles, like which one?
Yeah.
So this was really special. And we spoke for about 3 months to make sure that it was a good fit for both of us, because he had already kind of been down the road of having some people in that didn't work out. So when I got into practice with Frank, I had the ability now to help in his teaching. And it happened right out of the gates. You see, one of the things that in Washington is one of the courses you take in pros is you take a whole quarter course on how to put a lecture together, and then you give a lecture and you get graded on this one presentation.
Mm-hmm.
So you gave it to the ortho, perio, pros, oral surgery programs and the directors, and then you would get graded on this, right? So it was a whole course on photography and putting your content together, like, tell them what you're going to tell them, and then tell them all of that stuff. And so when I got into practice with Frank, I had already enjoyed the teaching aspect, because I came from teachers. My father was a teacher, my mother, my sister, like everybody was a teacher. So I was the black sheep going into dentistry, but then I came back into the family by going into education.
Right.
So when I put this lecture together, I enjoyed it. And so I put another one together for fun.
Mm-hmm.
Well, not for fun. It was for profit, because as a grad student, you're right. You would go do the study club circuit. For dinner. I was working for food, right? You're a poor grad student. And so I put 2 lectures together so I could hit the study clubs and I could get, some nice meals. So it was a nice transition with Frank, because I got to go into an educational practice with already having the passion of bringing an educational piece to what I did. I just got to do it at a much greater and different level by coming into practice with Frank. So it was really a good fit. And so, here we are many years later, where I have a huge role in the educational component, but I'm still in clinical practice.
How has Frank's stuff impacted you? So you look at, like, we've gone to all the Spear stuff, and I kind of started, when Frank was still doing hotel courses and all that sort of stuff, which was seems crazy now. But, so we pick up all kinds of things and you learn all this stuff. Were you being impacted from an educational perspective by him, or did you already have all this educational acumen?
That's a great question. And I would say it's a little bit of both. All right. So as a grad student at University of Washington, at that point, it was an amazing program. It was like, if you look on the international lecture circuit, a lot of the people out there across the world, they're the little bubble of UW trained prosthodontists and so it just groomed, like there's certain universities that are like quarterback like you want to be a quarterback in the NFL, this is where you go.
Sure.
That's kind of what UW was like. So I had a pretty good clinical background, but again, I'd never been in practice. So when I came into practice with Frank, he wasn't in clinical practice much, right? So I'll give you just generalization. When I came into practice with him, before I came in, he was seeing patients 30 days a year.
Oh, wow.
That's before I got there. Okay. So he was mainly doing things like you said. He's got his workshops and his hotel courses. That was his focus.
And in the
So
30
he needed
days,
somebody.
was he just treating dentists in those 30 days typically, or?
A lot of dentists, yes, a lot of dentists, and then it turned out to be a lot of like relatives and family and this types of thing. So when I came into clinical practice, Bob Winter was in practice with Frank,
Oh,
and
I
so
didn't know that.
yeah, so Bob was in practice with Frank, and so I actually got a lot of my clinical chops from Bob because Bob was in practice. So I was spending more time with Bob. So what I got from Frank then was the way to think through, like one of the things that he does almost better than anybody was take a complex problem, break it down into an easy to think of thought process that people can go, I can do that. Like that makes sense. I can do that. So when I would sit in on his lectures, when I was in practice with him, I'm taking tons of notes. And I guess maybe in the first year, a lot of my notes were maybe clinically based, but then it became, how did he just explain that? How did he break that down? Like, what was his thought process? So I turned myself into, how can I do what he does, but do it my own way? So I think I got a little of both from him.
Yeah.
That's awesome.
I think it's really kind of crazy. When I started down the educational path, I was what you would characterize as the aspirational doc. I was right out of school. I was dangerously competent, or dangerously incompetent.
Fine line.
And so
Exactly.
That's what it's. I guess what did they say? It's unconscious incompetence. You're so incompetent that you don't even know it. But I remember the first thing I did is I went to Dawson, and I thought, Dawson, okay, this is the fundamentals of occlusion. It's this, that, and the other. You go to Dawson for a week, and I feel like all you learn in a week is how teeth come together a little bit. And then he says, if you come back in another week, I'm going to tell you what a night guard is. If you come back for another week, I'm going to tell you how to do a night guard. And I was like, what in the hell is going on here? So then I went to Frank's course, Occlusion in Clinical Practice. And I remember one of the first things he did is he started talking about, how to equilibrate a case and this, that, and the other. And he's like, people talk about mesial upper, distal lower, all of this stuff. And he was like, the way he looked at it is just do whatever's easiest. If it's a crown, carve on the crown, not the tooth. He goes, don't worry about all that stuff. Do whatever's easiest. And that changed my whole trajectory in education. Is that how you've kind of started looking at how you teach, with kind of, let's simplify dentistry and let's simplify the process. Let's take the complex thing and show it to people in a simple manner.
Yeah, I think at least I try to do that. And I think Frank obtained that from when he was in the grad program. It was Ralph Udalis that was the program chair. And Ralph's kind of the guy that made that perioprost program like so special. It's all attributed to him. And he's the one that started that let's just simplify things. Meaning that it was back, like for Frank, it was back in the days of gnathology, where if you mounted your case and then you tried it in and you didn't have a perfect occlusion, you did something wrong. You got to remount it, right?
Yeah.
And so Ralph said, if it's not perfect when you bring it back to the mouth, grind it until it fits. This makes no sense to remount something 10 times.
Yeah.
Right. And so Frank then built upon that. Like, there's one thing to be in education and try to teach to this pinnacle of ideal.
Yeah.
And then you guys know there's clinical reality. Right. Like, how many times do you look at the schedule for the next day and in your mind, you can walk through your exact appointment. I'm going to do and then you get into it and nothing ever goes the same way.
Yep.
Right. So the clinical point is everything we do, you have to be able to think through what's the best way to get through this. What's the easiest way for me to do it that still maintains predictability? And so I think being an actively practicing dentist is imperative if you're going to be in education. Because, hey, what we do is not easy. No. Materials change, techniques change. And the question is, well, what's going to be the easiest that's going to get the outcome functionally or aesthetically or predictability wise? And let's teach to that. Right. But let's take all of the factors, and we can't dumb it down to the point where you're just, again, turning a blind eye to all of the shit that can happen.
Yeah.
But bring it in such a way that this makes sense, and I can hopefully tell it in such a way that there's a concept that you're going to get that you can apply across the board, as opposed to a cookbook, because nothing is ever a cookbook.
Right.
And so I hopefully, I think I've done it. I've come a long way. I have people come up to me all the time and they say, Gregg, don't take this the wrong way. But I heard you when you initially started working with Frank. I heard you teach, because Frank would like give me, an hour or so to do something. And they'd go, you weren't Frank. They go, but now I think that you've actually surpassed him. Like, you've actually improved the way you speak and the way you think and the way you break it down. It's like, really, it's amazing. And so they don't want me to take it the wrong way, saying that I was like shitty before. They say, you're better now.
I was in one of those seminars in Scottsdale where literally you came and Frank was doing the seminar, and he was like, hey, I've got this guy who's going to come up, Dr. Kinzer. And I remember we were all like, who is Gregg Kinzer?
Yeah.
What the hell's happening?
Yeah.
I thought I came to see Frank.
Yeah. And why is Frank taking a lunch break now?
And I remember one time I was supposed to go to a workshop, and it was when Frank was transitioning out, and they were like, well, Frank's not going to do it. Dr. Kinzer's going to do it. And I was like, well, I'm not fucking coming. And I could say I was wrong on that
one. I'll tell you what, that guy used to throw me to the fire, though. Yeah. Like, we would do these hotel courses, right? And it would be like, let's say it would be something in Seattle. And he would say, hey, can you come in at this time? And I have an hour and a half section that you can do. And I said, well, what is it? And he would say, it's super easy. It's like, it's your case. But here's the rub. He put it together himself. And I'm like, even though you might look at what he does and go, that's really clean, that's a nice way to think, that's not typically how my mind would work.
Yeah.
So I would have, like, he was already in the handout. And so I would get in there, 30 minutes before, and I would actually be like cramming, like for a test, looking at what he put together, because that's not how I would put it together. And then I'd have to get in front of somebody and do it. And it's like, this is fucking terrible. This is like a nightmare, right? And so, maybe thinking on your feet, maybe it helps you. But those early days for me were very stressful, unless he let me put it together myself. So there's a learning curve to everything we do.
Yeah. So that's one thing. You've kind of touched on a little bit how you and Frank are different. And how is that from going in, working with him? I heard a story on this other podcast that you're on, and you described it as Frank is really nice to patients and sees a lot of patients that you won't see. And your words exactly were, I'm an asshole when I need to be.
Yeah, that's actually quite, that's quite true. Frank is again, he's like just a big teddy bear. He's just a big sweetheart. He would have trouble, like, if he had to fire an employee, he didn't fire an employee. He would have somebody else do it. Right. So when he brought Gary DeWood in, and there was somebody before Gary, like they was helping to run his teaching, like that was the person that he had him do all of the grunt work, all the shitty things. Oh, I need you to let this person go. Okay, it's your job now. So I you can imagine this, that the pros practice is a dumping ground, right? For
sure.
Restorative patients.
Yeah. Sure.
And so, you hope that your staff can find the red flags and keep them out. But occasionally some sneak in, and Frank, once they saw him, he couldn't say no to him. So when I got into practice, I was the dumping ground for Frank's patients.
Mm-hmm.
Right? He gave me all of the headache patients, and
Of
so
course.
I was like, I'm not seeing them.
Yeah.
Right? I'm not going to do it. Like I know who this patient is. I've heard you speak about them. I'm not willing to do that. And so so I tried to control that environment very early. But I'm not Frank. And again, I remember doing a course with him in Seattle. It was like, let's say an occlusion workshop. And so he would teach didactically in the morning. I'd see patients, and in the afternoon, they'd come back in the office and I would help do the hands-on.
Mm-hmm.
And so I remember walking from the back up back to the front of the office at the end of the day and speaking with the dentist. And he was like almost perplexed. He's like, well, you're nothing like Frank. And I'm like, I looked at him a little confused and I said, I'm not trying to be Frank. In fact, I'm trying to make a name for myself and get out of his giant shadow that he casts. Not that it's bad, but it's like, I don't want to be the guy that's just there because of Frank. And you're going to listen to me. You're going to have to listen to me because Frank says you're going to listen to this guy. So
we've all done that.
I worked hard to be able to differentiate myself and just to do things my way, to think through things my way. And I think it took me some time to have comfort with that. Right. I think every young dentist who goes into practice, they emulate who they're with, right? Because that's the only thing you know.
Right.
You don't know, you haven't been in practice before. So you're looking at your mentor, whoever you're in practice with, and you're thinking that's the way I should do this. And in reality, you can learn a lot from the person, but you also have to find your own way.
Yeah.
And I think, you take some lumps in the process, but you get to the point where you find out who you are as a dentist and what your belief system is and what you want to achieve. What level of dentistry do you personally want to do?
Let's kind of back up a little bit. I'm a 54-year-old dentist, so I think we're reasonably around the same age. So when I came out as all PVS, everything you did was PVS. I worked with a Willie Geller oral design guy forever, and still work with him. And he's a master ceramist, and so he's still all PVS.
Sure.
Do you use any PVS? Have you transitioned to all digital? Where is your world?
Yeah. So I'm almost 57. Right. So I was built in the age of all analog. And as a prosthodontist, it's even more so. You're pushed into all analog. And now we're in a whole different part of dentistry because we have such a huge digital impact of what we're able to do. I would say that I am in both worlds. But because of my age, I'm going to say that I'm still probably more on the PVS side.
Oh, okay.
Because of my ceramist and because of some of the things that I know from my grad training that still have accuracy beyond the digital realm in certain pieces, that I actually now choose to be in digital and choose to be in analog, specifically on the case that I'm treating. So I'm back and forth. And it's confusing. It's a little bit confusing to my staff because they don't like, I'm going to throw them a curveball and they're going, I thought you'd do this one digital. Well, this one I'm going to do analog, and here's why.
Yeah. I mean, it's crazy. So basically every full arch I do and every, almost anterior case, anything I do with Skip Carpenter or technician is all analog. And, when I started doing digital aspects, now I'm a CIRAC user for kind of day in, day out stuff. I was like, well, Skip, you got to get on board, man. We got to start looking at being able to scan things. So we scanned cases with an iTero, with a CIRAC, and we took a PVS impression, and he made them all on the PVS, and we would take them to all of them, and it was crazy the difference in fits on those things. And the one where they all fit is the PVS. So that's where kind of my struggle is with it, because I feel like he's even the first one to say it. The digital information is great, and it's really good information, but you have to exist in the digital world to do it.
Yeah.
It's almost like he's like, he can't find a way to take digital and analog and, by printing models to make them predictable.
You're 100% correct. And I loved, you sound like me, because that's my take on it.
Because I'm a stubborn old dentist.
This is the get off my lawn dentist. Right? That's who we are now, right? That's what we are. But you're 100% correct. And I wonder if the newer dentists who've never lived in the analog world, they don't know this. They don't know what you just said.
Mm-hmm.
And you said it extremely well. Digital's great if you stay digital. But if you want your technician to have their hands on it, then if you want the analog world, you want the benefits that provides, you got to stay in the analog world, because otherwise you're leaving a lot on the table as far as accuracy of things that could be better.
Yeah.
But the reality is this: does it still work? Sure. But if your accuracy level is trying to get here, it doesn't work as well as it could.
Right.
Yeah.
See, I'm in the other side of that. I'm a little bit newer as far as how long I've been practicing, and I'd say I'm, much more digital than I am analog, but it's the same sort of thing. You can see certain cases and certain things that you do that you're like, I really wish. And the lab I use, he's great with the digital stuff. We get great results. But every so often with a bigger case or something else that I have going on, I'm like, well, let's do this one analog and let's see.
Yeah.
And, 10 times out of 10, the results better. And even my lab guys, like, I like doing some of this stuff more than the digital, because I have more control over the analog case than I do the digital.
Yeah. I mean, digital, like you said, digital every day, run of the mill, posterior.
Yeah.
Great. It's actually more efficient. It's way better.
Yeah.
But when you get in, I want my technician to be able to have the ability to layer ceramic on it.
Yeah.
We got to stay now in the analog world, because otherwise we're taking a hit on it's when you go back and forth that it becomes a problem.
Yeah. Even, apart from the ability to layer ceramic on it, I think when you start getting into occlusion, and maybe I'm wrong, but I feel like maybe you still cannot manipulate the digital cases as well as you can an analog case if you're trying to deal with a wear case and things like that. What do you see in that?
We're more in the analog world, but I will say that with some of the newer technology and ModJaw and some of these other more dynamic programs, I think we're going to get to the point where the digital world is going to be superior, because we can actually look at a true hinge. We can try to find a true hinge, and we can we can emulate movements of the patient, actual clinical movements. Before we start, we can bring those same clinical movements back in when we design the case. But when you do that, you're talking at a much higher level of digital for both the clinician and the technician.
Right.
So it's like you got to have a special group of people.
Yes.
It's the 1%ers that are doing it, right? So it's like, how long does it take for that to become mainstream?
Yeah.
And then you go, well, how often do you need that?
Right.
And I think it's for the special wear case where you really want to get things dialed in and you really want to look at movement patterns. But I think things are moving in that direction.
Yeah.
Yeah. So kind of with your impact on Spear, and now Spear has kind of absorbed CDocs and all of that stuff, and you have Mike Scramstad with you now, who brings a lot of the digital aspects. We had him on a podcast earlier, and he was talking about ModJaw and things like that. I think while he's in the same age bracket that we're in, he's totally in the digital world. How are you guys merging the two, or are you merging the two?
Yeah, we are merging the two, and it's interesting because it's not as clean as you would think. And so here's my challenge as an educator, because I get people who are all analog, I get people who are all digital, and then I get a mixture of people kind of in between. And so then you go, well, all right, how do we define it from an educational standpoint where you can't lecture and teach to a quarter of the room at a time, right? That makes no sense, because you're alienating the majority of the room. So you've got to be able to bring in both components, the analog and the digital component, and say that we can do it both ways. And so in this case, we're going to show it in this world. In this case, we're going to show it in the other world. So everybody comes out on the other end with the knowledge that they need to be able to be productive and successful in clinical practice. So it's an addition that is not as easy as you would hope, because you can't go all in, and you can't turn a blind eye to it. It's got to be a combination of the two.
Sure.
Yeah. With Spear, I mean, we've both been through a lot of y'all's courses and stuff. And, personally, it's the most impactful continuing education venue for me. The stuff that y'all have done, that Bob's done, has been, changing for me as a clinician. Y'all are constantly changing. FGTP was the capstone course kind of for everything. And now with treatment planning with confidence, you kind of touched on this a little bit, but how much of a change is that now from what Frank initially started with to where we are now and maybe going in the future?
Yeah, that's a really good question. So the backbone, as you said, the backbone of what we teach at Spear is that facially generated treatment planning idea. And even though the name is changed for the workshop, it's still facially generated treatment planning.
Okay, good.
Right. Sure. It was interesting. They changed the name because this is what I was told. It's a little funny to me. The thought process was, people don't know what FGTP is, so we should change the name into a more generic term. And I laughed. I said, that's silly. And I'll show you how silly it is in two ways. I said, people copy it all the time. You look out there and people are using aesthetically generated treatment planning or airway aesthetically treatment. It's like, you don't copy something that isn't good.
Sure.
You don't copy something that's shitty, right?
Yeah.
And I said, I'll also prove it to you a different way. And I said this, I said, you like, everybody knows what Chat GPT is, right? You all know what Chat GPT is. And everybody goes, yeah, we know what that is. I said, do you know what it means? Do you know what Chat GPT means? Because GPT is an acronym. And they go, I have no idea what it means. I said, this is FGTP. You don't need to know what the acronym is for, but you know what it means. It means treatment planning.
Right.
So in a sense, the course is the same, but I will say this, it's better. And it's not better because we're better than Frank. It's better because here's what one thing I think Frank has done really well is, you can only be an expert in like a couple of things, maybe one thing, right? And you're only one person, so you can't do everything. And so what he's done very well is he's brought in people, like Jim McKee for joints. And then we brought Mike in to help us with digital. And I brought Jeff Rouse in. And so we bring in experts to make us bigger and better. I think the workshop is better now because we've brought in Jeff and myself, and we've changed how we think of treatment planning. It's still based in FGTP, but we bring in an airway component in such a way that it makes sense in a regular general dentist practice. It makes sense. You're still doing dentistry. It's just a different way to speak with patients about the dentistry that they need, and a different explanation ideologically about why they are destroying their dentitions. And I also think we brought in different, everybody wants systems in practice, right? We have to have systems. When I came into practice with Frank, there were no systems. It was in the analog world, there was paper charts. And so I helped to develop some systems, and we went into the digital world with digital charts and radiographs and all these things that everybody does. And so it made me appreciate the fact that we need systems to gather data, and systems to think our way through how to assimilate that data to put a plan together. And so, we have probably, even since you guys have been there, we've changed the whole workshop. I think it's better now than it's ever been. A more logical way to get the data, what the data means, and how to apply it, and how to talk to patients, all of the pieces that you need clinically. I think it's a better workshop. Yeah. Because we know more now, and we're able to bring it all together and have a kind of a common voice, right? That's kind of one thing that it's been imperative for me, is when you bring in more people, you may start to have well, Bob does it this way, and then Jeff does it this way, but Gregg does it this way. And
Mm-hmm.
everybody now goes, well, who the hell should I listen to? I don't know who to listen to.
Mm-hmm.
And so we've worked really hard where we all have a common voice that is speaking down the same road. And you might hear something different, but it's still the same concepts that are being taught throughout. So I'm really proud of what we've been able to put together and grow upon what the foundation of what Frank did.
So kind of with what we're doing, simplified dentistry is something that we're trying to advance clinical skills for docs, and we're trying to advance it for who we call the seasoned and aspirational doc, who is somebody who's probably been seasoned doc, has been in practice for 10 years or more. Aspirational doc is the doc who came out kind of like me at the get-go and is trying to be somebody whose clinical career is advanced. What advice would you kind of have for a doc like me? I've been out 20 some odd years. I did all your stuff. And now I'm like, do I just keep doing what I've been doing, or is there a way to advance my career through what Spear is doing now, or what advice would you have for that doc?
Yeah, so it's interesting because even our participants have changed at Spear. So I've been a part of Frank since late 90s, right? So I've seen the evolution, and we used to have the mainstay of the docs that came in to see us were like 10 years or longer in practice, 10, 15 years. They've been through practice, they've made the mistakes, it's beaten them up a little bit because they're on that hamster wheel and they want something more. And so I think the program that we have put together at Spear, I call it a mini pros residency because it trains you to think like a prosthodontist. Now, there's also been an evolution. I think today we're in a really fun time of dentistry. I think with digital, it makes it more interesting. I can do more. And with the idea of airway, being able to do some of the advanced kind of orthodontic concepts, is advanced interdisciplinary care, I think makes dentistry really fun. And so I think for that dentist who's been down the road, and you're special because you've had a bunch of additional training. So let's say it's not you.
Will you tell my wife that I'm special?
I'll write you a note.
Dear Caroline.
It's what we've put together is it rejuvenates you because you're seeing patients with a different set of eyes, and you're helping patients differently than we used to. I'm helping them be better, feel better, healthier. The occlusion and the aesthetics, you're going to get that, but you're going to get a whole different support because of treating to the health.
Yeah.
But for people who are still in the realm of just doing single tooth dentistry, things like any advanced education that's going to give you a process to be able to I'm not going to say find new patients, because every office has patients who require a different set of skills. But if you don't see them and you don't have the confidence or the competence to talk or treat them, you're not going to talk to them at all.
Right.
Like you're sitting there as a clinician and you're going, I hope to hell they don't ask me what to do because I have no idea.
Yeah.
Right. And so,
I'll just dump them on the prosthodontist.
Yeah. A lot, I think a lot of those cases can be treated successfully in a regular restorative practice, but you
100%.
need a different set of skills, and you need the confidence to be able to know how to treatment plan them, how to talk to them, and then actually how to treat them. Right. You need like the full bag of tricks to be able to do it. And I think that's what we've created. But I think even for, let's say, someone like you who's been through it, things have changed. We have had such an evolution, and we have a new advanced treatment planning workshop. It's the culmination of our core curriculum that brings every piece together, from airway to worn dentition to joints to aesthetics. And it's basically 3 days of just intense treatment planning, bringing in all of the treatment planning options and how to utilize them. So it's like there's a little bit of something for everybody, that whether you're the seasoned dentist
Yeah.
Or you're in the other tier, which is that new level of dentist who's just like, I think I want to do more than I'm able to do. What do I need to do to be able to do that?
So what's your advice for you? You have a kid who's a first year dentist. So what's your advice for the rookie dentist?
The rookie dentists that are coming out today, I feel sorry for them because I'm involved in a couple of different universities, and I just know that compared to, let's say, when we went to school, we got all sorts of reps in, meaning we got to do a lot of dentistry, and so you get out and you have a pretty good feel for it. I don't think they get the same number of reps, and for those students who were in school around the time of COVID, even less. You know, I have a practice partner now who's an endodontist who's in the practice with me, and he teaches in the endo program and in the undergraduate endo program. And they may do one patient, they're just working on extracted teeth, and I'm like, God, remember when we were in school, it was like we had X amount of molars and anteriors and and then you go, fuck, endo's hard. But now you know it. So I think that the new dentists that are coming out, it's interesting. Our main people who are coming into, let's say, the treatment planning workshop today, when I ask them who they are, when they went to school, these types of things, the vast majority are out less than 5 years. It's a different than when I started with Frank, like everybody had already been through it and they're like, I've made the mistakes. You'll get those people who are seasoned, but most of them are young people, and they're being sent in by, they're looking at their senior doctors and they're like, you need to get a foundation now. But if you don't have that senior doctor that's pushing you for a higher level of education, you may be overwhelmed and going, that's too much for me right now. Like, I need to know how to cut a crown prep. So here's a little, sorry, this is a little aside. I was putting together something for Spear, and we were trying these new small bite informations. Like we're all of, I want information now. I don't want to spend 10 minutes watching a video. I want it to be in 2 minutes because my attention span is smaller. And so I thought, all right, what can I do for a dentist in a small amount of time that's impactful? And I thought, all right, what if I went through something that said, all right, how would Gregg look at a tooth and go, well, that should be a composite, that should be an inlay, that should be an onlay, or that should be a crown. That might be beneficial to a bunch of dentists. Sure. So I thought, in order to do my research, let me ask our daughter, who was just a new dentist. And so I said to Megan, I said, can you tell me what you're being taught or what you were just taught about when you do an inlay versus an onlay versus a crown? And her response like floored me. She goes, they're all crowns. It's all a crown. And I'm like, well, you don't get, you don't get knowledge. And she goes, no, it's like, everything's a crown because the school needs money. And that's how you get paid with insurance is you do crowns. I said, but they don't give you the foundation of what you would get out in practice and like preserving tooth structure and prepping less. And like when you would choose it. Nope. So I think that there is a need of tiered education. You got to build some foundation for a lot of these brand new dentists to get some reps in, so they think of things differently than what an institution might say as your dental school. And I know Spear is working very hard right now on that level. I don't want to say it's a dumbed down, but essentially it's more of a basic entry point where I got to help you do the best dentistry if you're just going to do single tooth dentistry. How to treatment plan it, how to do it, how to do composites better, how to do less invasive preps. And in that process, once you can build the foundation, all right, now you're ready to be able to look at things with a different set of eyes. And now let's go into things like treatment planning with confidence and get you to think differently. So there's been an evolution, because before, Spear was all about the inspiration or aspirational dentists, right? I want to be the best, whatever that means to you. Best in your town, best in your state. I want to be the prosthodontist. It's the best. Great. But now we have to focus also on the other people who just I want to be a better dentist than I think I am today.
Right.
And that might mean let's break it down into smaller pieces.
Well, it's really crazy because kind of coming into this, I was like, I want to ask Gregg about, what takes you from good to great, and what is Spear doing for that? I feel like I have an understanding of that. It's almost like Spear is having to go, well, let's get you good. I mean, we have to provide the foundations for you to be good. Forget being great.
Oh, yeah, you got to walk before you run.
Yeah, you're 100% right. And that's actually got to walk for your run, got to be good before you can be great. You're going to find the great ones in there who want to be great. But a lot of people I got a lot of classmates that I went to dental school with. I've never seen them at anything that I've done. I've never seen them in any course. Handful, yes. But everybody, a lot of people just want to I'm just going to plug away. I'm just going to do I'm going to do my single teeth stuff. I'm just going to be happy doing it. It's a good living. But I want to be good. Yeah. So we've never focused on that. We've always assumed a certain level of knowledge because that's, we're trained as prosthodontists. So we're thinking of it like a different level. So I think now we've taken a step back and said, all right, we've excluded a lot of people who can benefit from just being better at what they do. So they're focusing on that as well. We're not going to lose our inspirational, aspirational piece, right? Because that's our foundation. That's what we're built on. But we're going to apply that at a different level.
Yeah, I feel like Bob's course, the restorative design course, and then the anterior one. I mean, I feel like I got a solid education at the University of North Carolina, and set me up to be where I was coming out of school. But same sort of thing, like you were saying. We had a 1 semester course, 4th year, every other week, I think, called advanced restorative dentistry.
Yeah.
And so that's where we look at veneers and onlays, inlays, but it's the same sort of thing. You're taught how to do class 2s really well, and you're taught how to do crowns.
Yeah.
And then the rest of it, you're like, oh, here's this one course we're kind of going to throw a bunch of stuff at you. But then taking Bob's course, it really started to make more sense. And and Bob's course was one of those things that I felt like I walked out of that following Monday. I was like, oh, cool, I can use this in my office that next day.
His course is... it's the ROI on his course.
Oh gosh,
can be in place the next time you're sitting with the patient. And it doesn't matter if you're fresh out of school or you've been in practice 20 years.
Yeah,
you will be more efficient, better preps with more ideal treatment planning of preps after his course. So our daughter, who's a dentist now, we had her come and take Bob's course. She took my treatment planning workshop and Bob's restorative design workshop as a 3rd year.
Oh, wow.
And then I had to sit her down and I said, okay, she went to UOP. So 3rd year is like 4th year.
Oh, right? Yeah.
I said, now you're not going to be able to apply this in school. You're not going to take the burrs back and you're not going to you don't want to do that. Yeah. But I want you to see it'll make you better at what they're teaching you. But it also gives you a mind that when you're out, there's other things that you need to be focusing on your preps.
Yep.
It's not a crown. Right.
Yeah.
So I think it's that course is a really special course because by the time you're out of that workshop, it's 3 days, you've almost prepped like a full mouth or 2 full mouths.
Exactly. Yeah.
Yeah. It's really good. Bob does a great job.
Yeah. I came out of that course and my lab guy called me the next week. I'd sent some cases to him. He was like, man, he was like, you're pretty good, but you're a lot better now.
Yeah. What happened?
And I was like, I sent Bob a note. I was like, thanks.
Yeah, that's special.
Yeah.
Gregg, what's your advice for the tenure doc?
Selfishly, I'd like to hear this.
Tenure doc, has been in their practice, kind of at that crossroads.
Has their own practice for maybe 5 years.
I think we have things for you. And what I would ask you is what is your passion? What do you like focusing on in practice? Like at 10 years, you should know what you don't want to do. Right. Yes. And it's easy at 10 years because you should be successful enough that you can actually kick those ones out. Or you bring in an associate, right? And then you give here, you're going to do the dentures. And you're going to do the molar endo, whatever it might be. So I go, all right, what do you want to focus on? Like what jazzes you? What excites you? And sometimes you don't know what excites you until you see somebody lecture and go, I want to do those types of cases. I want that.
Exactly.
We have all of that at Spear. And I think the interdisciplinary for me, and I think for a lot of clinicians, treating things as a team, the team approach with my orthodontist and my periodontist and my oral surgeon, man, I'll tell you what, that's fun. You can do amazing benefits and changes for patients. And the passion when you're working in a team atmosphere, man, that's enjoyable. I love it.
Well, that's
I
one
think
thing.
a lot of dentists.
Yeah, we were talking about this earlier, and one of my big takeaways from Spear between your lectures and Frank's and everybody else's is the interdisciplinary kind of comprehensive care approach. From like the first lecture I took was a Warren dentition seminar, and
Well,
Frank
it's
would
about
talk.
building the team is the tough part.
Yeah, and Frank would talk about, well, this is me, this is my part of this is my orthodontist part, this is the periodontist's part. And so, how did you personally get your team together, and who's the quarterback of your team? I think I know the answer to that second question, but how'd you get your team together?
You know what? I think that my answer is terrible because my team was put together. I'm not going to say for me, but kind of, because it was the juniors of Vince Kokich and Dave Matthews, like the guys that they bring in. That was my team. In fact, a funny story. So Jim Janikowski is the periodontist that I work with, and I think he's amazing. He was behind me, so I'm like I'm the elder of our group. I was in the grad clinic teaching, and he was a student in perio, and he had finally decided that Vince Kokich Jr. or Senior talked him into like staying. He's Canadian, so they talked him into staying in Seattle, and Dave Matthews kind of talked him into practicing with him. And so he comes over to me and he goes, "Are you Gregg?" And I go, "Yeah." And he goes, "My name is Jim. And I thought I should introduce myself because apparently we're going to be working together." My team was kind of put together because I had the juniors of the people that were like the main three, Vince, Dave, and Frank.
Nice little cozy arranged marriage. Nice.
Yeah, exactly. That's exactly what it was. Just happened to work out. But I think your teams change as you go through. I think you're right. And you said that it's hard sometimes to put together teams because you got to have it's not just I need an orthodontist and I need a periodontist, is I need to have somebody who's passionate about what they do and they have the same vision that we have. Right.
Exactly.
So now you got to find a personality in it as well.
Right.
And you also have to have a team that wants to push and learn together.
Yeah.
Right. Because I'll tell you, the hardest person to find for the team is the orthodontist, because today the orthodontists have such an impact on the health and the airway piece. Yeah. But I'll tell you, as an orthodontist, it's not as easy as straightening up kids' teeth. It takes more time to do these big adult Warren dentition, expand them, jaw surgery cases. It's hard to make money on those. So it's finding the orthodontist who's tapped into that and wants to do that. That's a special. Find that orthodontist and give them a big hug and hang on to them.
Yeah.
But I think as you go through practice, you're going to find times where my team is going to change. But the team that's the most important. Now your question about who's the quarterback. I'm going to answer it two ways. I'm going to say it's me. But when I work with Jim, he laughs at that. He goes quarterback.
Yeah.
And I said, "Yeah, you're Canadian. You don't know what a quarterback
That's right.
is, right?" So his joke is, "You're not the quarterback, Gregg. You're the wedding planner. Right? You're the wedding planner of our group. You're the like, all right, the flowers need to arrive at this time, and then catering starts here." I said, "That's fair. I'll take that."
Interesting.
But I think that the quarterback changes depending on who's in your team, because I'm guessing you guys work with different specialists.
Yeah.
Right. And sometimes, depending on the specialist, I might know more than that specialist. And sometimes that specialist might know more than the restorative dentist. And so it's like whoever's got the knowledge base now becomes that quarterback to help drive the treatment plan.
Sure.
Yeah.
Right. But I think the onus is always on you and I as the restorative dentist, because we're the last person.
Well, you live with it.
Yeah. We're the ones that living with the case. Yeah.
You're the last one to have your hands on that patient. So if it's not set up well and it comes out less perfect than you would hope, who gets blamed?
Oh, it's
We
us.
do.
Yeah.
And it's because it wasn't set up correctly.
Yeah.
Now it's on me. So we need to have our input in there, because the fingers are going to be pointed at the restorative person.
Yeah.
That dentist is, who did that? Who fucking nailed those things? All the gingival margins are off. Well, that was, the orthodontist wasn't kind of set up well. The surgery. No,
I don't care.
It's on us.
Yeah, it's on us. Yeah. I'm dealing with that a case kind of like that right now with an orthodontist buddy of mine and his aunt.
Oh God.
And he's like, "Well, can't you do this, this, and this to correct it?" I was like, "I can, but why don't you put her teeth in the right spot first?"
One of the best things that ever happened to me is that orthodontist thought he was sending the patient to me, but he was really Mort's patient, and I was like, "Great, you keep her."
I mean, she's as nice as she can be, but it's a nightmare. She went to a guy in town too. I was like, "Let me just go send you to Patrick. You see what he," and she was like, "It's $85,000." I was like, "That sounds about like he's not going to make enough money on you."
One question I have for you is, we like to ask people, what is the mistake you made in your career that you learned from that really impacted the development of your career after that?
I haven't been asked that question before.
That's why I'm here.
Yeah, I love that question. What was the pivotal thing that changed? It was, you know what? I do have one patient and one treatment. You learn the most when things don't go well, and it's a hard pill to swallow. But when everything goes swimmingly, I'm not getting as much out of it. You need to be kicked down a little bit and then claw your way back up to the surface and go, all right, now it was a case. It was a worn dentition patient. I think we can learn a lot from those patients, where everything I did just didn't work. And it was constant occlusal issues, breaking provisionals, breaking things. And I was like, Jesus Christ, like, what am I missing here? And I finally worked my way back around it. And if I would have thought of it differently from the beginning, if I would have seen what I missed from the beginning, I wouldn't have been in the problem, but I learned so much from it. So I think when things break and patients are having all sorts of problems, you can learn a ton from that. So I think it's always an occlusal aspect, a worn dentition patients with occlusion and fracturing things. And I think as a clinician, we like to point the finger at the technician and the material, right? Oh, was it shitty material and the technician? It's never that.
Yeah.
It's always in the design aspect of it, and that should be on you and I. Yeah. It's a good question. That's a fantastic question. Thank you.
I had a couple little quick hitter questions for you, and then I know we have one kind of big question we usually ask everybody at the end. So when you need dentistry, who does it?
I have had Frank was my dentist when he was practicing. And now that he's not practicing, my wife is my dentist. So she is
very good answer.
Yes, smart man.
How did I talk our kids into dentistry? It wasn't me. They looked at their mother and they said, "Oh, this is great." So Jill does my dentistry.
Okay.
And she's fantastic. She was trained. She's not a prosthodontist, but she plays one in my office.
Sure.
Okay.
But she's a Microscope Academy dentist, was one of the founding members, and so she's always been dialed into a higher level of dentistry. So she's my clinician. Yeah.
Nice. Red or white wine?
Red.
Nice.
Red. But I have appreciation for white. I'm now start with white and then move into red.
Nice. What's your golf handicap?
7.79 right now.
When's the last time you played?
I have not played. I have a child who is graduating from college from Arizona State. So I played with him in October was the last time I played in Arizona.
Okay.
I took him down.
Do you take Scramstad's money on the golf course?
I've only played Mike once. I beat him the one time, but I shouldn't have beaten him because
Okay.
that guy's amazing.
Yeah.
So I've never played with him again.
Yeah.
And then I guess one kind of clinical one, air driven or electric handpieces.
Always electric. Biggest
And-
change when I got into practice was electric. And when
Yeah.
people say I got mad money, I want to improve my practice, what should I do? Electric handpieces.
Nice.
100%.
And what brand of electric handpieces?
Started. I'll tell you what. When I started in practice, we started with Cavo,
Mm-hmm.
and then Brasseler NSK came out with their handpiece.
Mhm.
I had two electric handpieces, two electric high speeds.
Yeah.
And I would go back and forth between the two. Now Brasseler NSK is my go-to handpiece.
So did you ever
same thing for us?
Did you ever change from the Brasseler NSK to the actual just NSK?
No.
Because
no.
I mean, I do a little work with NSK, and I hear a lot from them about how the actual NSK is different than the co-branded NSK.
Are you using? What is the difference? I'm anxious now. No, you just might cost me money.
So, yeah.
Buy new handpieces.
So like the Z95L.
Yeah.
The Brasseler version to the NSK version is smaller. I mean, the NSK version is smaller, so the head's smaller. The angles are a little different. So it's like they've made like the stripped down version. Like you're using the Toyota versus I've got the
Lexus?
the Lexus. So that's kind of what they say. There's a little bit more advances in the NSK versions, and then they're going to the Z99L, which they're sending me one to test in a couple of weeks. But it'll be interesting. Yeah.
I think I should look into this now, because there are always times where I go, this handpiece is just too big for that person's opening and the tooth I got to hit. So if it's a smaller head, different angles, it might actually make my life a little easier at times.
Yeah, they have that Z85 that they built. It's a smaller one, but it's also lower torque. It's weird.
I'll send you a picture that I have of it's almost like man is starting to walk and is coming out of the water, and it's literally all of the NSKs throughout my career. And it's kind of crazy to look at the head sizes, but I'll send you a picture of that.
This is fantastic. This is great.
Yeah,
I love it. Thank you.
Nice, good. We gave you something. Nice.
Yeah, I love it.
And last question.
A little money though.
That's right. Maybe I'll get the NSK guys to send you one.
A teaser.
That's right. The other question that do you know which NSK motor you're using? Any idea?
Off the top of my head, I don't.
Yeah. Yeah, I've been transitioning to some of their motors too, so we'll have to put our heads together on this one later. The last question we like to ask everybody, obviously we're Simplified Dentistry, and kind of our goal is to help docs make dentistry simpler. Dentistry's hard. So what is your advice to our listeners on how they can simplify practice?
I think that you need. I think simplifying practice is one thing. I think getting more enjoyment out of practice is the other piece to that. Right? Because you can keep your world simple, but you might not be enjoying what you do. And if you can, you've been in practice for a while. I've been in practice for a long time. You're in practice almost 30 years.
Mm-hmm.
God, I hope you like what you're doing for 30 years. I hope it's not like Monday morning comes, you go, Jesus Christ, like, here we go. Starting up again.
Yeah.
Right. So I think the enjoyment and the simplicity and the predictability, I think those three things to me all go together. And I think in order to do that, I just think you need to find a mentor that enables you to think differently, to pull as much enjoyment and predictability out as you can. And then do the dentistry at whatever level that you want to aspire to, right? If you want to do full mouths, that's a boatload of stress and worrisome things. But if you just might want to do more predictable dentistry on the anterior for wear patients, whatever that level is for you, find a place where you can go that's going to give you the competence and confidence to be able to do that. I think that's going to simplify your life. So you're not going home at night thinking, oh my God, what the hell am I going to do with that patient?
Yeah.
Right. That's what drives us crazy, is you get a handful of patients and you're just perplexed. Right. And then you get gun shy and you never want to see them again. You never want to see that patient type again. And I think you can serve more people and you serve them better by gaining confidence and competence in what you do. But you're not going to get it just out of dental school. It's not. They're going to give you the basics. That's it.
Well, thank you very much, Gregg. We've enjoyed having you. We really appreciate everything you do for the profession, and thank you for taking the time with us.
Yeah. Thanks again, Gregg.
Hey, this has been very, very fun for me. I enjoyed talking to you guys. You got some really good questions. I like the back and forth. It's been a pleasure. Thank you.
Awesome.
Sorry, I cost you some money on hand pieces.
No, I'm going to come out better on this, though.
That's right.
I like it. I'm
That's
all
right.
about the new toys anyway, so I'm excited for that.
That's right.
Nice.
Well, thanks again, Greg. We
Thanks,
appreciate
Greg.
it.
Thanks, gentlemen.
Yeah. See ya.